My name is Manuel Carmona. I am a pediatric emergency physician at the Steinbrenner's Children's Emergency Center at St. Joseph's Hospital. The main reason why I would bring my own child here is because I know that every single pediatric emergency physician is not only sharp, caring, but also dedicated to children. I believe that excellent service is rendered when you are ready for anything that is going to walk through the door. And we are ready for it. Many parents have concerns whenever we have a child that needs specialty care. We are at the level of that subspecialty, with the understanding that whenever we do need them, they are here and we work 100% together as a team. That puts the parents at ease. When you look at this trauma room, this is pediatric emergency medicine at its core. We can do surgeries in this room. We can do anything that it is required to save that child's life. We have access to child life services where if the child is scared, they can help them with manipulating behavior and alleviating the stress. That's very helpful. As we all know, the emergency rooms can get very busy. And our group has determined that depending on the volume that is already studied by years of research, we know when to have double coverage. Double coverage is when you have more than one doctor, two, sometimes three doctors at the same time to be able to facilitate the care and decrease the waiting time. So in the majority of the time when you come to the Pediatric Emergency Center at St. Joseph's Hospital, there's going to be double coverage as far as pediatric emergency physicians. Whenever you do and are able to save a life, you know that that child will continue to be productive in the future, as well as when a parent gives you a real thank you from the heart, that sticks to you for a while. What separates St. Joseph's Pediatric Emergency Center from other ER hospitals in the region is that we are fully staffed with pediatric emergency physicians and with specially trained pediatric emergency nursing. We have every single subspecialty in the pediatric realm of medical care to be able to immediately take care of that child without exception. We are very proactive in decreasing whatever times are prolonged by studying the different parameters that affect that time period. And we are very involved with the hospital, physicians, and nursing staff to help each part of that process to be more effective without decreasing quality of care. So as we all know, the emergency rooms can get very bogged down by the volume of people that show up. We realized that we needed to be able to take care of the urgent patient that was not able to be seen by their primary care physician, and we developed what we call Fast Track. Fast Track is an area where you're able to order any type of blood work or x-rays. There is no decrease in the level of care, but what we do is see the children that would or could be seen by their primary physicians but are unable. St. Joseph's investment in technology and the Pediatric Emergency Center allows us to give not only better care but much faster. St. Joseph's Children's Hospital is very dedicated to children. The Child Advocate Center at St. Joseph's Children's Hospital, its main purpose is to help save children's lives. One of the many services that the Child Advocacy Program has incorporated in the Pediatric Emergency Center is actively being involved in the care and assistance with children that have a suspicion of abuse or actually have been abused. That program itself was incorporated in the Pediatric Emergency Center. And this, in my opinion, gives you a view of how dedicated St. Joseph's Children's Hospital is in truly being an advocate for children.